All right, hello everybody. My name is Randy, and I am the BC Regional Program Coordinator for the Vancouver Career College RMT program. And thank you very much for joining us tonight for this information session. I really hope we can answer all of your questions and get you really excited about the program that we are offering here. A little bit about me. I went to West Coast College of Massage Therapy and graduated back in 2003. So that means I've been working as an RMT for 21 years now. Um, I still love the profession. I still do work in a student clinic, or I still work in a clinic out in Pitt Meadows. And I really love all the opportunities that it's given me along my career and all the different things that I've been able to do along the way. So I am still active as an RMT. I've been working with Vancouver Career College in Burnaby for 12 years, everything from an instructor and now the regional program coordinator to help and assist our three different campuses. So we have two Vancouver Career College campuses, one in Burnaby and one in Abbotsford. And we have one CDI branded college with the same curriculum and the same structure down in South Surrey. So for today's session, I do ask that everybody leave their microphones and their videos turned off for the presentation. If you have questions, we're more than happy to answer the questions. If you could write them in the chat, then we're going to get to them when we get to the Q&A section of our presentation today, and there we'll be able to answer all of the questions that you have for us. So with that, I'm going to move on to our first slides. So again, welcome to our registered massage therapy info session. So we hope you enjoy this overview about the rewarding world of registered massage therapy. Today, this info session is meant to guide you through the program details, the career paths, the industry, and whether you're a current student, an aspiring RMT, or if you're thinking about switching careers, this information is meant to guide you and help you make a very important decision. So thank you very much for joining us today. So what we will cover today, we are going to talk about what is registered massage therapy or RMT. We'll talk about what a registered massage therapist does, why you might want to pursue a career in RMT, the different career opportunities that we have, an overview of Vancouver Career College and what we offer, a breakdown of our program, any this available student and career support services we have available. We'll talk a little bit about alumni success stories. We'll have an opportunity for frequently asked questions and then a question and answer period where we will answer your questions. Some key takeaways and the next steps if you feel that this is a program that is right for you. So what is registered massage therapy? So registered massage therapy, or as we call it, RMTs, is a healthcare practice. So we are a regulated healthcare field in British Columbia. We're regulated by our college called the College of Complementary Healthcare Professionals of BC, so the CCHP BC, under the same umbrella as naturopaths, chiropractors, acupuncturists, and that sort of thing as well. So we do provide evidence-based therapeutic massage and assessment, which focuses a lot on relieving pain, reducing stress, improving mobility for overall health and wellness. We're able to treat and help with rehabilitation after injuries. We work a lot with ICBC, Workman Safe, WCB claims to help people get back to work. And there's a lot of different things that we're able to do. So what does a registered massage therapist do? Really, the key thing is we have to assess our patients. We have to figure out what is going wrong with them. We make a treatment plan and try to use evidence-based techniques so that we can help this person return back to optimal health, help them maintain their mobility. And really, most importantly, we try to have people being able to live their life doing as many things that they want to be able to do with the least amount of pain. So we promote and maintain the physical well-being of our clients. We have to make sure our therapeutic services are tailored to the individual's needs. When you go to a spa, usually a spa practitioner will just do the same massage over and over and over again. They follow a routine and it's not individually tailored for each person. Whereas RMTs need to do an assessment. They'll plan out a treatment specifically for that individual. Whether the goal is more relaxation because the person is stressed, whether they're in pain, whether we have an injury that we're trying to help them rehabilitate. We have to figure out what's going to work for them based on where they're already at. We work in all sorts of settings. So you'll find RMTs in clinics with other RMTs. You'll find us in multidisciplinary and interdisciplinary clinics, which means we might be in clinics with kinesiologists, physiotherapists, chiropractors, naturopaths. Like there's a lot of different practitioners that complement one another very well. Sometimes you'll see RMTs in spas and other kind of wellness studios. Sports organizations often have RMTs come to help athletes with recovery and rejuvenation, helping prevent injuries. And then you can find private practice RMTs as well, whether it's home-based or mobile massage. There's a lot of options for us. One really key thing that's becoming more and more evolved with our field is we collaborate really regularly with other healthcare professionals. So whether that's the person's primary doctor, a naturopath, a physiotherapist, a chiropractic, we really try to focus on patient-centered care, which means we figure out what it is that the patient needs. We provide them what we're able to, but we'll also refer and communicate with other healthcare professionals to make sure that patient is getting the best care for them so they can heal and get on with their life much, much faster. We try to address the growing health trends like stress relief. We have so many people that work long hours, very stressful roles, poor posture at work, poor ergonomics, lots of sedentary lifestyle, sitting a lot, injury recovery, and overall wellness. So why might you want to pursue a career in RMT? There is an increasing demand for all wellness services in Canada, and in BC, it's still a very, very in demand career. We have a lot of aging populations. We have a lot of people who are stressed out all the time. A lot of people who work 8 to 10 hours a day sitting at a computer or driving. So lots of sitting, lots of sedentary lifestyles. RMTs also have a fairly flexible career options. You can work full-time, you can work part-time. Most RMTs are self-employed and work as contractors, where we'll basically rent or lease a space in the clinic that we're going to be working at. So we're mostly self-employed, but you'll find that occasionally there are some employment options, like at a spa or a few different models where you're hired as an employee instead of a contractor. We actually go into this in pretty big detail during our program to make sure you're very, very aware once you get out about the different types of pros and cons to each of these options. So our business course in term 7, you will look a lot at a contractor versus an employee relationship and the risks and benefits of both of those. RMTs, we really, really work towards a great work-life balance, taking time off when we need it, working our schedule around our lives and our families, being able to set your own schedule. Personally, I have 3 kids. They are all teenagers and they all play ice hockey. So usually the evenings involve driving around in circles to get everybody from one rink to the next rink, go back and pick them up again. And yeah, I've always been able to manage my schedule around the family situation as well. The most important thing really is it's a very rewarding career. We're able to help people. RMTs who are good RMTs, their patients really pick up on the fact that they are there to help. They want to help. They want to see this person get better. And they're not only here to collect a paycheck. It becomes really evident for patients if that is your goal. So if the money is the only thing that you're interested in, you probably won't have a very successful practice because your patients will pick that up and they won't be back. So we really do focus a lot on helping others, making people feel better, and really making a difference in their lives so that they're able to participate in their life to the fullest. RMTs do have a high earning potential. It's a pretty physical career, but if you use good biomechanics, you protect your body, you really do good self-care, then you can make pretty good money with it. As I said, I've been working as an RMT for 21 years. I have hurt myself way more in my sports, like playing hockey and motorcycling, than I have in my work career. But I'm really, really mindful about the way that I use my hands and the way that I use my body while I'm working. So, and another great thing about it is we love what we do, and there are lots of different opportunities for us to focus on working with a patient population that we want to work with. So my passion is for a long time been with working with sports therapy. I love showing up, even if it's a volunteer gig. I love showing up and helping athletes and young athletes and seeing the difference that the treatments can make in their overall performance and their recovery process. You really, when you're passionate about something, it doesn't feel like work. It just feels like you're going to play. So there's lots of different areas of therapeutic focus. We're not allowed to specialize, but we do tend to attract patients based on what we're good at and what we like to do. So some career opportunities, I think I've mentioned quite a few of these, but I'll go over them as well. Clinical practice. This is the most common. So most of our RMTs work in a clinic. The clinics can be in rehabilitation centers. They can work with physiotherapists, medical doctors, kinesiologists, chiropractors, naturopaths, clinical counseling. There's a lot of different very complementary practices, acupuncture, work well together and really help to promote a well-rounded approach to helping our patients. You can find RMTs in spas, wellness retreats, and fitness centers. Sports therapy, the opportunity to work with athletes or sports teams for injury prevention and recovery. I've worked with the Vancouver Whitecaps for a season. I've worked with the Team BC at the Canada Summer Games in Regina one summer. Lots of volunteer opportunities with amateur teams. So yeah, there's more than enough athletes who could benefit from your expertise. Private practice. So usually this is building a personal client base, whether it's a home-based business. You're almost always running your own business. And again, we'll go into a lot more detail about that in the course itself. And areas of focus. So I mentioned sports massage a lot because that's been my focus. But you can also find practitioners who really focus on prenatal or women's health, myofascial release, palliative care, end of life care. There's a lot of different options, and you can pursue and work within your passion. All right, so why might you want to choose Vancouver Career College? We have professional instruction. All of our instructors have been in working as RMTs for a minimum of 2 years in the field. They have great knowledge and qualifications. They all must be currently working in the fields. They're still in the trenches as we speak. RMT instructors, you'll find that we have a lot of instructors because everybody is still practicing as well. And their qualifications will make them better suited for certain courses. So a sports massage therapist would be teaching a sports massage class. Somebody who focuses more on systemics and pregnancy in their practice will be teaching that style of course. Relevant career training programs. Vancouver Career College maintains close relationships with the larger healthcare community. We ensure our curriculum is in sync with the demands of the marketplace, and that when you graduate, you're actually going to have the skills to be successful. In other words, we don't just teach you for the board exams. The board exams we'll talk about in a little bit here, but They're your licensing exam. They're showing that you have the bare minimum skills so that you can be safe in your practice and provide effective treatments. We do go above and beyond that. We talk about skills like myofascial release and advanced practice and communication with other healthcare practitioners that will make you a great therapist. A lot of clinic owners have commented to me how great and well prepared our students are once they've graduated and joined the workforce. So Vancouver Career College has 6 campuses across British Columbia. The RMT program is located at just 2 of these. So the RMT program is located in Burnaby by Metrotown and another one in Abbotsford off of Clearbrook Street. But we do have many other campuses which provide a whole bunch of different types of programs from early childhood education, electrical, practical nursing. There's so many different options for you. All of our campuses are centrally located near shops, business districts, and most importantly, public transit. Learning for success. Our programs are run on a modular basis, so you learn one subject at a time and before moving on to the next. The RMT program, we do it by semester, and I'll show you a breakdown of our program coming up soon. Oh, what happened here? Oh, it's coming up next. So here it is. This is our program breakdown. As you can see, we have 8 different terms. All of the courses in term 1 are taught concurrently. There are 5 days in a week, and we'll teach 2 courses per day. So it might look like having that musculoskeletal anatomy course on Monday morning, and then massage theory 1 in the afternoon. You can see that there are different hours. So the number of hours basically is telling you how many classes per week you're going to have. So for an 11-week semester or 11-week term, a course like MSAC, the top one there is taught 3 times per week. It's a 3-hour course. So over the course of 11 weeks, it totals 99 hours. So you basically have 10 blocks through your week. Monday morning, Monday afternoon, Tuesday morning, Tuesday afternoon, and it will be the same the next week, and it'll be the same the next week. You'll always have the same courses on the same days. Class times usually run from 8:30 in the morning until approximately 4 in the afternoon, give or take half an hour here or there. After each 11-week semester, we usually have a 1-week break. Your time to rest, recover, get all your shopping done for the next semester because it is quite busy. The courses, it's a full course load, as you can see, Monday to Friday, 8:30 till 4. It's after that time that you have to do your studying for the quizzes, review for the next class the next day. There are group projects, there are assignments. A lot of students say they're on average putting in about another 3 to 4 hours of studying time each evening. The terms are 11 weeks long. There are multiple assessments along the way. So you'll have quizzes, you'll have group projects, assignments, midterms, oral practical exams, final exams. So your mark is never made up of like just one great big test. You can't fail one test and fail the whole course. Usually quizzes are worth 5 to 10%. Midterms, maybe 20, 25%. Group projects, 5 to 10%. So you have lots of different opportunities to show your learning, and it doesn't all depend on just tests. Starting in term 3, you'll notice we have Clinic 1. Clinic 1 right there. Clinic 1 is your first opportunity to work as in the practicum. Our student clinics are on site at each of the massage therapy locations. There are 10 treatment rooms at both the Abbotsford campus and the Burnaby campus. Usually we have 2 shifts a day, a morning shift and an afternoon shift, and the clinic is open from 8:30 in the morning until 9 at night. Just before you get to that point, the clinic supervisor will reach out and say, hey, what's your preference? Would you like the morning shift or the afternoon shift? Or an outreach opportunity, which I'll talk about in a minute. You can make a preference, but ultimately you are responsible for making sure that you can attend your clinical shift that you're assigned. And if you're going to go to an outreach, you do have to make sure that you have your own transportation and you'll have to take a massage table with you. Outreaches start simple. We go to a corporate outreach in term three. There are outreaches at nursing homes, outreaches at sporting events. We have an outreach coming up soon, hopefully with a women's shelter. Lots of different opportunities. The purpose of outreaches is to have students able to work with different patient populations that maybe we're not going to see coming into our student clinic. So we have a more diversified learning experience. As you move through the program, you're going to have clinic every other semester after that. So term 4, term 5, term 6, term 7, and term 8 all have student clinical hours. The ultimate goal, you have to have a minimum of 330 hands-on direct clinical hours with your patients in order to graduate. There's 550 hours total, which includes indirect credits, things like charting, cleaning up or helping with laundry, administrative duties. Those will give you indirect hours, but the really, really important ones are the hands-on direct credits. And for those, you need 330 hours to graduate. You can, in our student handbook and on the website, you can see more breakdown about what each of these courses offers. In term 8, we go back and review everything from the start, everything you learned in each of the semesters in sort of a shortened, condensed form, basically as a review to prepare you for the board exams. The College of Complementary Healthcare Practitioners of BC hold board exams here in BC twice per year. All of the students from any of the massage schools in the Lower Mainland all have to write the same board exams. There's a general knowledge test, basically a science test, which is a 3-hour exam that has 150 questions. Then there's a practical-based assessment. It's a 1-hour exam with different stations to see different competencies and skills that you have. And we try to mimic that in our clinical synthesis class. We have, and the last of the board exams is a law, regulations, and ethics exam. Basically, do you know the bylaws? Do you understand what's right and what's wrong when you're working in BC? Province to province, there can be some variation in what's allowed and what's not allowed. For instance, scope of practice. In BC, RMTs are not allowed to do cupping as a technique, but in Ontario, they can. So you have to know the rules based on the province that you're in. So that's the whole thing. It's 88 weeks in total full time, bringing us to 2,751 hours. Just for when I took the program back in 2001 to 2003, it was a 3-year program totaling 3,000 hours. Now our program is pretty close to that, 2,750 hours, but in 22 months. So it is quite condensed. So yeah, completed in as little as 22 months. Each semester is 11 weeks long, but we almost always get a week-long break in between, sometimes 2 weeks in the summertime. So you get a little bit of a break, and in the end, it takes about 22 months. There's about 600 hours available for clinical practice. So much in-person training. We do have electrical tables. We have an infrared sauna. We have some state-of-the-art facilities available to our students to use. And we also have lots of hands-on clinical placement for real-world experiences. You will get out and get to work with people with Parkinson's. You'll get to work with people who, have just crossed the finish line at a marathon. We try to provide lots of different opportunities. Some examples of courses that we have. So anatomy and physiology is basically your biology 12. Learning about the cells, learning about the organs, the systems of the body, and what makes our body work. How does our body work? Massage theory is one of our first practical courses. It's a course where we're learning the basics of communication, informed consent, proper draping, and really simple Swedish massage at first. We'll get more and more complicated with the types of techniques once you know the body better and can understand the different pathologies and different injuries as you learn about those. Therapeutic exercise, a good example of that would be stretches or strengthening techniques. It is in our scope of practice as massage therapists to provide exercise routines and as home care to give our patients. If we only see a patient once every month, then it's really important that the person is able to maintain the gains that they've made and maybe even be able to progress and get a little bit better. So therapeutic exercise is a really important component of the overall wellness of our patients. Neurology, you'll learn about the different nerves that the body has. Nerves and muscles work together, they're integrated, they have to cooperate for our body to work properly. So you'll not just learn about the peripheral nervous system, you'll also take courses on the central nervous system and how the muscles work in conjunction with those nerves. So, according to the Job Bank at the Government of Canada, there is still a very strong demand for registered massage therapists. There's over 6,350 job positions in this sector projected for 2023 to 2025. In my role as the program coordinator in Burnaby, I regularly have clinic instructors, clinic owners message me, send me emails. Hey, have you got any students graduating? Can I come and talk to them? Can I put up some posters? How do I get in touch with your students? Because we desperately need more massage therapists at my clinic. And honestly, if I let them all put up a poster, we wouldn't need any wallpaper in the school. There's so many people looking, so many clinics looking for good RMTs. So there really is not a big issue at all in being able to find not just a job, but the job for you. You have the ability to be picky and pick something that is close for you, pick a focus that's within your passion. There's so many different aspects that you could look at. You don't have to pick the first job that comes along. Vancouver Career College has really great student and career support services. On site at each campus, we have a student services team. They provide personalized academic and administrative support to you. So if you need it, you can just go into the administrative office, ask for some help, and whether it's financial, whether it's student service, whether it's like marks or grades, you can ask any questions you like while you're in school and also for up to 6 months afterwards. We have a career services team that will help you if you need it to make resumes or prepare for job interviews. If you haven't done that sort of thing in a long time, the career services team can help. They haven't been that busy with our RMT students, though. Usually by the time term 5 or term 6 roll around, most of our students have already been approached by a clinic or have sought out a clinic to work at and do some body work or some non-therapeutic massage at. So yeah, we don't keep our career services team all that busy in the RMT program, but they are there if we need them. They can also really help with job search strategies and placement assistance. The other really helpful thing for our students is financial advisors. They can help you with your funding options, look at different ways that you can access the money that you need to get through the program and to still eat at the same time. They can help you look for scholarships and help with your budgeting. So here's some words of wisdom from some of our alumni. These are not in the RMT program. So I'll share an experience a little bit more relevant to us in the RMT program. Our program literally changes people's lives. Our mission is changing lives through education. And we have had students, one of my current friends, she's one of my colleagues, one of my closest dear friends now. She was a student in our program about 8 years ago. Before she became an RMT, she was a single mom of 3 kids, could barely make ends meet, was working 10, 12-hour days and still barely able to pay the rent. And she struggled in the program. Not gonna lie at all. She struggled. She failed a few quizzes here and there. But she kept working at it, and we gave her a lot of support so that she really understood the material and was always able to move forward. She didn't even pass her boards on the first time, which was okay. We brought her back. We let her sit in a couple of classes to audit, to help her remember some of that material, help her build her skills back up. She passed the boards on her second time. And now she's working just a nice round, 4 days a week in the clinic and 2 half days as an instructor. So a very manageable schedule. She's able to, live comfortably. She even went on a holiday to New York in the spring. So it really can change lives. Just being able to access this education and walk out into a really, strong career. So let's look at some frequently asked questions. How long does the program take? Well, all in all, if you include the breaks, it's just under 2 years, so about 22 months. You will have to take the board exams before you actually get your registration. The board exams happen in the spring and in the fall of each year, so there might be a little bit of time between your school graduation and the board exams. So, about 2 to 2.5 years before you're actually working as an RMT. So what are the licensing requirements? First, you have to get your diploma from one of the accredited schools in BC. That is your ticket to write the board exams. As I mentioned, there's the 3 board exams. You must pass all 3 of them. If you happened to fail one of them, you only have to take that one again. You don't have to take multiples, just the one that you failed. Once you have completed it and successfully passed your board exams, then you have to do a criminal record check, working with the vulnerable public. You need 3 references to, show the integrity and professionalism of your character. You need to maintain your standard level first aid and CPR, and that has to be ongoing. You can't let it lapse the entire time you're an RMT. And you'll have to do some continuing education. So always learning, always building your skills, always trying to be the best therapist that you can be. The next question here was, can I work while I'm studying? This one is a little bit tricky because not all students are starting at the same place. We have students who just graduated from high school, and we have students who were medical doctors in another country and want to still work in a healthcare field. So really, if you have a strong background in biology, if you have taken some postgraduate work, you might have a little bit less of a studying load than others who have never taken that sort of thing before. Remember, you're in classes full time, Monday to Friday from 8:30 to 4. You need to eat, you need to sleep, and you're going to need time to study outside of the class as well. So if you do have to work, I'd really stress that make sure your boss knows that you're going to be in this very intensive program and have some options for flexibility, especially if you look at the schedule and you have 5 midterms coming up in 1 week. It'd be nice to make sure you can focus on studying the weekend before all of that. What are the job prospects after graduation? Well, a lot of our students are working even before they've graduated. So you can do non-therapeutic massage in spas or even in clinic as body workers, as long as you're not providing therapy. Sometimes you make an arrangement with a clinic to work there up until your graduation at a lower rate, obviously, than a RMT. And then once you've graduated, you will send over your licensing information to them, and they'll upgrade you on the ranks to becoming an RMT. There are all sorts of different possibilities with clinics. There's hundreds and hundreds of clinics in the Lower Mainland, and you can find them all throughout British Columbia as well. How does the practicum placement work? The practicum placement for the most part is on site. The student clinic on site at each of the colleges is, as I said, a morning shift and an afternoon shift. You can work, you can have a preference, or you can go to one of the outreaches if you really have an interest in specific patient populations. You have to You have to do one starting in term 3, and you'll keep that ongoing up and all the way until term 8. So some key takeaways from our presentation today. Why choose RMT? Well, it is a fulfilling, in-demand career with flexible opportunities. Why choose Vancouver Career College? We have loads of hands-on training. We have experienced instructors who are currently working in the field. There are no wait lists, and we have strong career support. Career opportunities. There's so many opportunities. You really can forge your own path a lot of the time. There's diverse paths in clinical, wellness, sports therapy, and private practice. Program features, you can graduate in as little as 22 months. You'll gain real-world experience through those clinical placements. And support services. We have comprehensive academic, financial, and career support to guide you on your journey. So at this time, I'm going to introduce you to Ritu, who is one of our admission representative program advisors. She's going to talk to you a little bit about what some of the next steps, if you're interested in the program. And after she's done with her part of the presentation, we'll move on to answering your questions that have been popping up in the chat. Take it away, Ritu.
Thank you. Thanks a lot, Randy. Hi, everybody. Um, so the way to start with the RMT program is I would recommend, because it's an intense program, as Randy suggested and said. It's a huge commitment. It is definitely recommended that you book a one-to-one meeting to discuss the program in detail. So you actually can sit with the program advisor and understand exactly what each term would cover, which courses you would be doing, and what does it mean, and how does your day will look like when you start the program, and how much of homework is required to be done. Once you book that appointment and when you visit the campus, you're also able to meet with the financial aid advisors, who can then let you know about what are your options about applying for student loan, and if there's any options of grants, etc. And then we can also go over the enrollment requirements for that program. Once you have all that information, I would always recommend to students that go home, think through it, and if you're ready, you can visit again the admissions office to start your application process, or we can start that online as well. We are doing an intake right now. So as Randy mentioned, we've got 3 campuses offering this. So we offer it under the brand of Vancouver Career College in Abbotsford and Burnaby. And we offer it under the name of CDI. That's one of our colleges itself in South Surrey. So we have a cohort starting in Abbotsford on 20th of January. We still do have some spots available. And we have a 24th February start cohort in South Surrey. In Burnaby, we have a cohort starting in January, which is very full. And we have started doing intake for 30th of June class. So if anybody here would like to apply even to start in 2025 June, now would be the time to set up your appointments and visit, because it's become very competitive to get into this program. I guess it's because of the work-life balance and the gratification that you get after helping so many people, and the of course the compensation that you make after getting into this career. So you could schedule an appointment for visiting the campus. Burnaby would be, I mean, if it's closer to you, or Abbotsford or South Surrey, but do call before you visit the campus so that you have a student advisor available. Um, I would say that would be it, Brandy. So if you want to go over the questions, or I will look at the questions, and then between two of us, we can do that. So the question that I see here is, the first question was, what is the total fees of the course? So the first year of the program is 22,000 approximately, including everything. So books, tuition, taxes, your clinical, all the material, everything included is 22,000. The second year is 20,000, and this is eligible for the government student loan. Our financial advisors, when you come to the campus, you meet with them and they will guide you through the process of applying. In our experience, most of the students do get funded at least the tuition amount. And depending on your personal and financial situation, you may also be able to get extra money for your living expenses, but that totally depends on your personal and financial situation, and the financial advisors will be able to give you insight into that. Uh, the scholarship for this program, there is really no scholarship available. It's such a sought after program. We just offering a very small scholarship of $2,000 for our Abbotsford campus. Um, because this is the first time we are starting a program in Abbotsford. So if you wanted to apply for the Abbotsford campus, you would have a small scholarship. The next question is, what if you struggle through whatever course? Is there help offered? Do you offer rewrites for tests? If so, how does that work? Um, I'm going to give it to Randy now to reply that question.
Yeah. Okay, thanks for your question, Jordan. So during the program, we have a lot of different assessments along the way. So we have quizzes that are worth maybe 5 to 10% each. Group projects might be, 10, maybe 15%. Midterms and finals, 20, 25%. So we kind of structure it so that you do a bunch of small quizzes building up towards a midterm. And if you have failed a quiz, it's only worth 10%. It's not something that is going to help make you fail the course. But we would reach out to you. So we'll reach out to you, say, hey, you failed this quiz. What help, what assistance do you need? Do you have access to all your materials? What's going on? And we try to make sure that that trend doesn't still happen. You get to see all your marks all along the way on our learning management system, so you can keep track and see where you're at. Now, we don't offer any rewrites for a test that you failed, but if you fail a whole course, we have a few different options for you. So in the first year of the program, you have one supplemental exam available to you. So a supplemental exam is an exam that covers all of the course material and allows you to prove that you know the material. Maybe you just had a couple of bad days and you weren't able to pass the course. So the supplemental exam allows you to hopefully show that you know the material, and then you'd be allowed to move on to the next semester with the rest of your classmates. The other option, if you have failed a course, is in the first year you have 2 course repeats. So if you didn't really understand the material, we give you the option to come back and repeat the course again. You don't have to take all of the other courses that you had in that semester. So you get more time to focus on the material, get a little bit more help, have a lot less distraction with it. So in the first year, so that's from terms 1 till the end of term 4, you have 1 supplemental and 2 course repeats, which is equivalent of 3 fails. But after you get past term 4, we add an additional supplemental exam and an additional course repeat. So in total, you get 5 chances in the 2-year program that if you were to fail courses. And we do try to prevent that from happening with just really clear communication, really clear help and assistance. We have tutorials available most evenings. We have an instructor who will stay and help students if they have questions or are struggling. We reach out with the instructors trying to help and creating learning plans for the students, helping them understand the questions and that sort of thing. So we really do try to help students stay on top of things and know where they're sitting in the program.
Thank you, Randy. I would just like to add one thing here. I've been working with RMT students as a student advisor for almost last 13 years. And my take on that is that this program is very intense. I would always tell students like it's like going to a medical school for 2 years. But that being said, there is no rocket science. The students I've seen being successful in this program are the ones who have grit, who know what they are getting into, who are ready to study 11 weeks at a stretch and then relax for a week. So as long as you guys can wrap your head around the fact that for 11 weeks, we cannot have weekend parties, we cannot socialize too much, and you let everybody around you know, and you're ready to do solid learning for 11 weeks, you'll be fine. But you have to be ready to study. It's not like a program that it's not like a 4 hours a day program where you can just start, finish, and then forget it for the rest of the day. But it's very doable. Next question, Alejandra. She says, does one need biology 12 to enter the program? No, it is not a requirement. Biology 12 is not a requirement or is not a prerequisite to enter the program. However, because between the time you apply for the program and you start the program, there is time. So if you've not had any kind of a sciences background, it doesn't harm you to take a biology 12 course, or just get a biology 12 book from the library or borrow from somebody and go over it. It will definitely make your term one easier for you.
Yeah, there's no warm up. We get into class and you start learning on the very first day. There's very little, hey, how are you doing? Welcome to the school. We get started, and the first anatomy physiology class is about the equivalent of biology 12. So, if you haven't taken science or if it's been a really long time, we highly recommend it.
Correct. Next question, Fanny. What is the schedule? So schedule is Monday to Friday, 8:30 in the morning to 3:30 in the afternoon. So your first class is 8:30 to 11:30. Then you have a break for an hour, and then you have 12:30 to 3:30. And then you go home, and then you need another 2 hours to study. So that's your life for 11 weeks at a stretch, and then you have a break of a week. And after the fourth term, you usually have a break for 2 weeks. Okay, next question, Jay Preet. Prerequisites. So the prerequisites are you need to have high school and you need English 12 with C plus. Now, we get a lot of students who've not done their high school in Canada. So there are ways to meeting that requirement. If you are from any other country and you've done your high school there, as long as you have your high school diploma and your transcript, there is a report that we can get, and then that will make you eligible. Again, that is not something which can be explained here, but if you are not from Canada, so don't feel bad that I didn't do my high school in Canada. Whichever country you did your high school in, as long as you have your documents, that would meet the requirement. But some more paperwork needs to be done, but we can do it at the campus. Again, for English as well, for students who took English 12 in Canada, and if they don't have the required grade, you can take a 1 month online English course with us, and you will be able to meet the requirement. If you did not do English, or if you did not do high school in Canada, then also you can take a 1 month English course, meet the requirement, or you can also do the IELTS exam, which I think is more difficult than taking the English course with us. But again, it's one-to-one, and if you visit the campus and meet with the student advisor, they will be able to guide you. Is there any limit how many times a board exam can be offered? So Bhumika, the board exam is, you can attempt it 3 times. It's like any licensing exam. If you are becoming a doctor or a CPA or anything, every licensing body allows you 3 times. And then, like Randy had mentioned before, so there are a total of 3 exams. And if in the first time you fail two and you pass one, then the second time you're going to be going only for the 2 exams that you did not pass. And frankly speaking, if in 3 times you're not able to pass the 3 exams, then you should not be becoming a professional RMT. I don't think we've had very many students or any student at all who failed all 3 times. So it's totally doable. Jonathan, what is the average amount of homework we would get on average on a week-by-week basis? On an average, Randy mentioned, I also said that you study for 6 hours in school, you need at least 2 to 3 hours at home. Is that right, Randy?
Well, depending on your background, obviously.
Yeah.
And there might be times with more, especially you've got group projects and assignments. So yeah, some students say 3 to 4 hours each night.
Mary Kate, how often does the RMT program take in another round of students, as in how many months apart does term one start again for new students? I would say about 6 months apart. Is that right, Randy?
Yeah, basically, we take a term one course. They move after 11 weeks, they move into term two. And then after another 11 weeks, when they move into term three, that's when we're taking another term one class. So we always have terms one, three, five, and seven going. And then they move into terms two, four, six, and eight. And then we go back to one, three, five, seven. So yeah, about every 6 months.
Jason, has anyone been successful in getting funding from Work BC? Yes, we've had students who've been funded from Work BC, but not very many. The only reason being that Work BC usually would sponsor students for a program which is just under a year or a year. And then they also have a funding cap of 7,500. However, to answer your question again, if your case is very strong, and this is the career that they approve you of, then we've had students who've been funded by Work BC. Song Ho, is there class session for enhancing professionalism or business development that are relevant to RMT program? I'll ask Randy to answer that.
Yes, we actually have several classes. The first 3 semesters, we have professional development one, two, and three, talking about professionalism, boundaries, communication, um, ethics. And then we also have a whole dedicated business class where you'll be looking at business plans, marketing, all bios, like how to make proper bios, proper resumes. And they also look at the differences, the pros and cons between being a contractor and being an employee. So we do have 4 or 5 relevant for business and professionalism. Yeah.
Thank you, Randy. Bayant Kaur, if I have no science background, is this course for me? I did auxiliary nursing midwife from my backcountry and 10 years of job experience. So we already talked about it. You do not need a science background as a prerequisite. However, it is recommended. That being said, you can, between the time you apply and you start the program, you have time. You can brush up on your anatomy, physiology, biology before you actually get into the program. You would, like I said, like we said, that the classes start every 6 months. So you have a lot of time to, kind of brush up on your anatomy, physiology, borrow a book and go over it. Um, Alejandra, what about funding for PWD students? Is there any funding? So students who are on permanent disability, we always recommend that you first meet with the student advisor and let us know what kind of, if you need any learning accommodations. If you do, we would have you meet with our campus director or Randy and see if we can actually provide you those learning accommodations. We want to make sure that we are not setting you up for failure. We would like you to be successful. Um, and as far as the funding goes, so when you apply, if you're applying for the student loans have extra funding or grants for students who are on permanent disability. So you will be able to get those grants. There's some paperwork that your doctor will have to fill out, and then you can apply for that. We'll help you apply for it. Jordan, you guys have part-time and full-time. Are the intake dates different? We do not have part-time. We offer only full-time program. And this is what I would say to the part-time option. The thing is that this program, when you take this program, you cannot start working till you pass the board exam. Like you cannot start working as an RMT till you pass the board exam. It is painful to go through this program. So you do not want, hello? Yeah. So you do not want to extend this pain. You also have to remember, hello? You have to keep all of this option, um, all of these understanding and all the learnings that you have done in your head to be able to pass the board exam. So the sooner you can finish this program, that is the time that you have to keep that in your head. so that you can pass the board exam. So if you do it part-time and you extend this pain for 4 years, then remember that you have to keep that thing in your mind for 4 years because you still have to pass the board exam after 4 years. So it is advisable to do it as a full-time program and then get it over with. Um, I I don't see any other question right now. Does anybody else have any question? Okay, so I have put my name and my cell number in the chat. If you guys have any questions that comes to your mind later, you are very welcome to call. And then we can also, I can answer it over the phone. And also, if you would like to set up an appointment to visit the campus, we can do that too. And just so you know, the campuses are open through the Christmas holiday. So we are working except for the Christmas day.
All right. Yeah. Any other questions, guys? Oh, you're welcome. Right. Well, I really want to thank you all for being here and listening to the presentation today. Hopefully, we've been able to answer all of your questions and really stir up some interest if you think that this is the right program for you. I wish you all a very happy holidays, very safe holidays. And please reach out to Ritu or find us on one of our social media what do you call them now? Social media outlets so that you can get in touch with us if you're interested. And again, thank you so much for being here tonight, guys.
Thank you, Randy. Thank you, everybody else, and happy holidays.